Call our Finance Committee to order at 3:07, and we've got a quorum here, Dr. Martin, myself. First, I'd like to welcome everybody today to our finance meeting, March 28th, and go ahead and read our conflict of interest. This is this opportunity for each member to disclose any potential interest that they, in their belief that they can be unbiased or enabled or able to participate, or they elect to recuse themselves from the matter. So, next item on the agenda is the minutes.
Move approval.
Okay, I had one correction. It was just a misspelling of my name. So, with that, I will second the motion. Any question? All in favor?
Aye.
Aye. Motion passes. Excuse me. Next item on the agenda is the fiscal year 23 update for our CFO, please.
Okay, good afternoon. This is going to be real brief because the Crossland partner is going to present at our board meeting to the full board. We do have a clean or unmodified opinion for 2023 audit, but I would defer questions and so forth. I know they were in your packets, but defer questions until we get to the board meeting so the entire board has an opportunity to ask questions of the audit partner and myself.
Okay, and I apologize. I failed to, and this is totally my fault. I think I'm on too much cold medicine, so I apologize for that in advance. But I failed to allow for public comment at the beginning of our meeting, so there is time at the beginning of every meeting to allow for that. So if there's anybody who is registered and is interested in making a public comment, please come forward.
Is 3 minute.
Okay, our public comment is for Jeanette, okay, Southpaw, so we're recognized. Thank you.
Thank you. Thank you for this opportunity to present to the Finance Committee. I'm Jeanette Southpaw, and I'm the Executive Vice President and Provost of Meharry Medical College. As many of you know, Meharry Medical College lives its motto of worship of God through service to mankind. We use this foundation to shape everything we do. This includes the important and longstanding support and care that we have provided to the patients of Nashville General Hospital for the past 25 years. We at Meharry are proud of that work. It has been central to our college's mission to care for and lift up the people of Nashville for nearly 150 years. To ensure that quality continues, I am here this evening to provide some insight into how Meharry has approached our partnership with Nashville General Hospital in recent years. Our goal is transparency. Meharry appreciates the opportunity to address several issues that have been raised before this Hospital Authority Board and the Finance Committee that are contradictory to the typical narrative of an institution that is considered the index hospital of an accredited medical school in the U.S. An index hospital is a critical part of a learning environment that has standards defined by the Liaison Committee on Medical Education, which accredits medical schools. These standards describe an atmosphere conducive to professionalism, sufficiency of faculty, and clinical experiences. Professional services agreements between an index hospital and a medical school function not only as business documents, but that support accurate and timely payment for services, but also assure that the partnering educational institution, in this case Meharry Medical College, has access to faculty who are clinically and academically competent and willing and reliable not only to model and provide excellent care for patients, but exhibit professionalism and teach these principles to students and residents. Currently, those standards are not being met by Nashville General Hospital. Nashville General Hospital leadership has reported a number of things to this Hospital Authority Board and Finance Committee regarding the relationship between the hospital and Meharry that are not supported by fact or are incomplete. Number one, any reduction of certain services by Meharry has been done in response to a lack of hospital support for infrastructure and nursing staff to provide quality of care. NGH has failed to attend multiple mutually scheduled meetings to resolve these issues. NGH has hired clinicians independently and without consultation with Meharry. These hires either were the result of NGH aggressively recruiting Meharry faculty and hiring them at a higher salary while refusing to pay Meharry for their services according to agreed PSA guidelines. In some cases, NGH hired independent physicians who refused to teach students or residents or who possess inadequate credentials to qualify for faculty appointments. NGH has billed CMS through the state for resident services and then refused to pay Meharry for these same residents at the current rate. NGH has canceled key contracts with Meharry and or Vanderbilt specialists, sometimes hiring others with limited scope of practice credentials, thereby compromising our ability to maintain residency faculty and training requirements. Each time NGH contracts for these providers and cuts Meharry out of the process, the hospital is in direct violation of the PSA, to which it asserts it is compliant. These actions reflect a diminished level of commitment by NGH to the medical school that we have experienced in the decades since we first began working together. While refusing to pay faculty funds owed to Meharry, NGH has diverted dollars to establish off-site practices that cater to commercially insured patients, leaving only the uninsured for Meharry to care for. This leaves Meharry to absorb the majority of the losses associated with this care. This is not the model for municipal support of a city hospital, and in effect is creating a segregation of care that will promote and extend health disparities in our community. NGH has also begun to establish a parallel research enterprise with attendant new hires, while an excellent one already exists at Meharry, Vanderbilt, and the Meharry-Vanderbilt Alliance, while again failing to compensate Meharry according to the PSA. All of these actions clearly violate the PSA. Equally concerning, they are obscured in the reports presented to the Hospital Authority Board, which seem designed to discredit Meharry with no basis in fact. Such actions can harm the delivery of care and hurt our academic enterprise moving forward. My findings regarding this situation and comments today are based upon my experiences at 4 other medical schools spanning more than 40 years in academic medicine, where I have helped to negotiate many successful partnerships. I have significant expertise working within models that work and believe that for the good of the patients we serve, Meharry Medical College in Nashville, Tennessee deserves such a model.
Okay, thank you for your comments. And that is all the allotted time, so thank you for your comments. I appreciate that.
Thank you.
You're very welcome. Seeing that there are no other names on our guest speaker allotment, we will move on to the next piece. My main go ahead, I'm sorry.
Well, I thought you were going to ask for the budget update, or do you have a comment? I'm sorry.
Yeah, I will ask for the budget update. But I do have just a quick comment on that. Based on the Ms. Southpaw's comments, I would like to propose that we give our administration an opportunity and time to respond appropriately. So I don't know that you want to respond immediately, but if that's something you want to table and make sure that we cover at a different time, I would welcome that opportunity for our hospital to do so. Thank you.
You know, at this time, I would just like to acknowledge that if there are any activities or initiatives that Meharry would like for Nashville General to engage in, we're happy to honor and respect those. I don't think it would be appropriate to go into any detailed retort or response to that litany of comments and accusations that was just presented.
Okay, anybody else? Okay. Okay. Thank you, Dr. Webb. And again, I think it makes sense for us to have a different conversation outside of this specific meeting to address anything that we need to move forward with. So thank you. Our next item on the agenda is the budget update.
Thank you, Christy. I'm sorry about that cough. You're in a good place. The budget update, we did present the budget at the last February meeting, and it was approved by the board, but I just wanted to give a basic update that Dr. Webb and I, the next week, presented those budget details to Metro Finance, Mayor's office, et cetera. I did include the little short PowerPoint in your package, just in case there's interest in looking at it. The numbers are as we presented to the board and as were approved. There was a little bit of, I tried to tone it down because they're not hospital board members, so in some ways the audience was a little bit different, but the numbers and the basics were the same. But I thought it went real well. Dr. Webb and I had most of Metro Finance leadership, some folks from the mayor's office, their quality performance improvement leader, and some others on the call. I thought it went really well. They treat us like one of the Metro agencies. So just like all the other agencies go through the process of presenting their budgets, we too, and then at some point in the next 60 days or so, we'll get some response probably from the mayor's office, the administration, and then we will have to work back to this board with a final budget for approval. We will update our year-to-date numbers each month, and so you'll see some movement in the FY24 numbers, but we're hoping the FY25 numbers are pretty solid unless we learn of something that changes dramatically between now and then. So that's just a brief update on the budget for 2025.
Thank you very much. The next item is back to you for the financial reports.
Yep. All right, January financials for the hospital. Busy inpatient month, 244 admissions, up almost 30 over prior, a little over 30 from last month. We had 165 observation visits, and our patient days were very close to the budgeted number of 1,000, so right on that number. Our length of stay, I would say our hospitalists, including our residents, are doing a really good job this year. Our length of stay is 4.0 for all admissions, well below the budgeted number, and that's where we've run all 7 months this year at 4.0. Significant improvement, physician cooperation, rounding, our new UM team that Dr. Blackledge has brought in, better performance all around. Emergency department was flat for the month, basically 2,300 visits, even with last month, and close to budget, not quite there. Our clinics suffered a little bit in January, just under 2,900 visits. Most of that was that week that we had Snowmageddon or whatever we called it. Our clinics were basically closed for 4 days, and that also affected our elective surgery, inpatient, outpatient cases. You can see those were down, as well as the cath lab was down. We basically lost a week of elective cases in all those locations. Deliveries were light last month at 23. The budget was 38%. And last year at this time, our deliveries were up significantly, about 15%. This year, they've actually trended back down to where they were 2 years ago. So a little bit of a decline in volume there. I'll just say, Dr. Blackledge and I have spent a little time. Our case mix, if you look at the bottom of the statistics page, our hospital case mix, it has been down about 7% this year. It could be that we're moving patients through so quickly that it's affecting our case mix, but we're looking through the data on that to see if there's anything else from a documentation standpoint that might be an opportunity for us. Then we get into the actual monthly financials, the income statement. Total revenue for the month was about $3.4 million short of the budget. The inpatient number was about 18% below, and that's case mix, and then obviously the length of stay being shorter than what we had budgeted just impacts the gross revenues there, not the net. And then in the outpatient arena, because we had those short weeks for clinics, for our elective areas, our observation and our OR and our clinic numbers were all short of budget for the month, and that accounted for that 1.8 million gross miss in revenues. We did have a good payer mix month, so the patients that we did have come through, both on the inpatient and outpatient side, had had a better payer profile for us. And so we actually expect $4.8 million of collected revenue for those patients. The budget was 5.2, so we missed by about 8% there, a little bit shy. Our other revenues this month, they have been running ahead all year. Unfortunately, January was not a month that we received any significant payments in our other revenue line, so well below budget for the month on that. But then we were high on the essential access. Those two both run in opposite directions, still a negative, about $600,000 impact for the month versus budget. And our total net revenues for the month were about $1 million shy of the $12.8 million budget. On the expense side, most of the negative is in the contract labor, which has been a concern for most of the last couple of years since COVID. We did make some changes in contract labor. We have several open positions in the hospital, director level positions, and our security service. We are reclassing those costs into contract labor, just like we do with nursing. So that number looks unusually high for the month. We were just making reclass entries for it in the month of January. Otherwise, most of our expenses were pretty close to line. Supply costs were actually better than budget. Still, with the $12.5 million of total expenses, we suffered a negative margin of about $750,000 for the month. The budget was to make nearly $1 million. And I say that, but understand that if you move across to the far right, you'll see that for the year to date through 7 months, the hospital's actually made a small profit of $4.4 million. And that puts us about $8 million ahead of the budget for the year. That's all I have for the month of January. I'm happy to answer any questions.
All right, our next item on the agenda is the revenue cycle report for January 2024. Ms. Blackledge?
Thank you. So we do have a slide here. So I'll start off by talking about the whole being greater than the sum of its parts. So one of the areas of focus that we've had for several months now has been about synergy. How do you bring the team together? How do you make sure we're executing? That part has been critical. And in the graph, you can see in January 23, we were at 89%, and we finished January of 2024 at 114% of net revenue. So that's pretty important. And what does that look like? We can say over a period of 15 months ago, we were collecting $4.6 million on average, the average of those 15 months. And we can trim that down to say 12 months, we were at 4.7. That's the average of a 12-month period. And again, 9 months average at 4.8, 5 month average at 5.1. So we can see our steady increase. And that's a result of the synergies that we're bringing to the table. And that's for not just the back office team. We normally refer to revenue cycle as back office, but that's the entire team from Nashville General Hospital. So that's the synergy piece, that's the collections piece, and we've had cross-functional teams running together, and we're positioning ourselves for growth. So clinic ramp-ups, you guys know we opened up a clinic this past week. So we've got the clinic ramp-ups and other opportunities. We're just strategically aligning ourselves for the benefit of the organization and our community as a whole. So ended the year, started off the year, ended the year to date at 114, and ended the year at 98.6 as a percentage of net revenue. So outstanding to the team. We'll move forward right there. Thank you. So every member of the team gets to participate in Unbilled, and this just a collection of all the activities around the hospital. We kind of translate that into a set of codes. We take that, we send it to the insurance providers. They pay us. So the faster we can get it out, the faster it comes in. So we ended at 4.93 the month of January. And so that's significant for the organization. If we reflect over the 13-month period in front of you, that 13-month, the 4.93 days is the lowest it was over that period of time. And so that was a decrease from December to January of 2.84 days. So shaving that off is what we want to do. The last thing I'll talk about is denials. Everyone in this room has heard about denials. So we are trending down from November to current month end that we're looking at January. And so kudos to the team for that trending down. Bruce said it earlier, we have brought Faith Reed on board from a utilization management, prior authorization, and verification standpoint. So both Faith and staff are engaged. And this is one reason we see the trend down. As a complement, we have others surrounding Faith to support and execute on those pieces. Our challenge is staying abreast of all the regulatory changes and matters. And you guys know that insurance providers change these every day for us. So our duty is to make sure we interact, notify, and educate all those involved. And to that point, we are now going out to clinics. We have Jessica Crabtree, who's behind me on my left side. And then we have Faith Reed. They both are going out to clinics, educating, answering questions, asking questions, just locking arms so that we can execute and talk about what we need to discuss to handle the business of Nashville General Hospital. And with that, that would be the last piece I have. Any questions, Dr. Martin or Ms. Smith? Either one. Any questions?
It looks like you're seeing some good trends.
That's what we want, good trends. And the continuation of good trends.
Thank you very much.
All right, thank you.
Congratulations on some positive movement. That's exciting. Seeing that there's no further items on the agenda, yes, ma'am.
Can we get a motion to approve the financial report, please?
Sorry.
So moved.
Second. Any discussion? All in favor? Aye. Thank you. Seeing now that there are no further items on the agenda, do I have a motion to close the meeting? Thank you. Thank you.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information on this and other programs, visit nashville.gov.